I don't understand any of this.
Yes, selecting a health plan can be confusing. Hello, I am Kevin Canals, an independent health insurance agent in California and also a certified Covered California agent. And California has many different health plans for individuals and families throughout the state, but some of them are very regional and they may not be offered to you. Now, the industry speak is that we call these insurance companies carriers, because actually some of them are kind of like health plans that are HMO, and some of them are PPOs that have different regulatory stuff. So we just call them carriers. So there are 12 different carriers, and they have 15 different plan types available to Californians for individual and family plans. When I say plan types, that would be like EPO or an HMO or a PPO. So we can see that Anthem Blue Cross offers their EPO product in Northern California and their HMO product in San Joaquin Valley and Southern California. So they don't cross over. Balance by CCHP offers their HMO plan in San Francisco and San Mateo counties. Blue Shield of California has an HMO plan that is not statewide, but is, lots of different counties, so you need to check to see if it's available to you. Blue Shield of California PPO is the only health plan that is truly statewide, from Crescent City all the way down to the Imperial Valley. HealthNet of California offers an HMO in Southern California and a PPO in parts of Sacramento and Southern California. Inland Empire Health Plan offers an HMO plan only in Riverside and San Bernardino counties. Kaiser Permanente is kind of statewide, but it's very zip code specific. So, for instance, if you're in Placer County, you might have access to Kaiser, but if you go up Interstate 80 towards Lake Tahoe, you may be too far away and Kaiser is not available. LA Care is only in Los Angeles County. Molina, they are in Southern California and some of the eastern counties. They have a HMO. Sharp Health Plan is only in San Diego County with their HMO product. Sutter Health Plan is an HMO in Sacramento, the North Bay, and the Peninsula areas of Northern California. Valley Health Plan is only in Santa Clara Valley, and Western Health Advantage is in the Sacramento area and the North Bay. Now, Covered California, which represents most of these carriers, they do a good job with their shop and compare tool. They put out a map. You can kind of look at this one and see where all the different regions and the different plans are being offered, but you will not find Sutter on there because Sutter does not sell their health plans through Covered California. They are only off exchange, direct from Sutter. And this is the map for the Sutter health plan. You can see parts of Nevada County down into Stanislaus, over into the East Bay, down to Santa Cruz, up San Francisco, and Sonoma. So it is a viable alternative for people. Now, all of the health plans I mentioned, excluding Sutter, offer their health plans through Covered California. So they're all on the exchange, and you can go through Covered California, which, if you may qualify for a subsidy, that's how you would get it, because you need to go through California to get the subsidy. And if your income is low enough, you may be eligible for the cost sharing reductions. So again, most all of those plans are available through Covered California. But many of the carriers also offer off-exchange plans. And this is where you are enrolling directly with the health plan and you're paying them direct. You're not going through Covered California. And you would want to do this if you want a Silver 70 plan and you're never going to be getting a subsidy, because the Silver 70 plans are about 5% less expensive if you go direct to the carrier. But of course, there's never any subsidy. There's a particular reason for that. Sutter is only available off exchange. The provider networks for these health plans off exchange are exactly the same as if you went through Covered California, so you don't have to worry about that. Never a subsidy because it's just not going through Covered California. And the other significant difference is there's only a 30-day grace period to pay the bill, whereas Covered California you can go up to 90 days and then still get the health plan reinstated. When you go off exchange, many of the carriers will offer what we call non-standard benefit design plans. So Covered California only offers what they call standard benefit design plans, but the carriers can offer non-standard benefit design plans off exchange, and they can be slightly less expensive than going through Covered California, which may be a benefit if you're never going to receive a subsidy. The cost sharing, the copays and the deductibles, maximum out of pocket may be slightly different, so you have to really carefully analyze the plan to make sure that you're not getting yourself into a pinch and actually having to pay more for healthcare services or prescription medications. They all have the same provider network, whether it's a standard benefit design plan or non-standard. And you can see here I've highlighted those companies that are offering the non-standard benefit design plans off exchange, which are Balance, Blue Shield, Kaiser, and Western Health Advantage. And then, you know, it's kind of good to see how these plans operate. And one thing is if they have developed a mobile application, because that can be a real boon for managing the health plan. Now, virtually all of the carriers are going to have some sort of mobile application, maybe tied to that My Health Online, where, you know, it's kind of tied to the medical group and you can see upcoming appointments and lab tests and things of that nature, but it isn't telling you about your actual health plan, if you're late, if you want to change your payment method, and that's what the mobile applications do. Plus, you can see other information about healthcare billing, evidence of billing. So the Anthem Blue Cross, they have a mobile app. Blue Shield does. Health Net of California has a mobile app. Kaiser Permanente has a mobile app, and Molina. None of the others that I could find have one of the mobile apps that really ties into the health plan for you to review your status as a health plan member. Then what about, you know, the health plans is, you know, a lot of people think they're evil because they deny claims and they have all kinds of problems. And these plans are regulated by the California Department of Managed Healthcare. And if there's a problem and they investigate it, the plans can be fined. And so what I did is I got into the DMHC Enforcement Actions website, and I just looked for the last 18 months from the beginning of 2025 through 2026 to see what sort of enforcement actions, penalties had been levied. And all of the companies, except for Sharp Health Plan in San Diego County, had some sort of action by DMHC against them. Now, I want to caution that this doesn't mean that all of these health plans, these carriers, are trying to screw the consumers, because sometimes the enforcement actions aren't necessarily for individual and family plans. They might be for small group or large group or Medi-Cal. And sometimes the penalties don't involve the delivery of health care, but they're more about record keeping, sometimes complaints, which can be very important. But all of these penalties, enforcement actions underscore the complicated regulatory environment that these health plans must operate in from local, state, and federal levels. Now, the next area is customer service, because that's kind of what a lot of people turn to and really get upset with on the health plans. And these kind of scores are subjective based on my experience with the health plan and what my clients and other people have given me feedback on. And so I just kind of ranked them a little bit. And what you will notice is that potentially those smaller regional carriers are going to have better than average customer service. Why? they're smaller. Generally, the customer service staff is in California. It's not offshored, so you're usually talking to an individual when you can get through and actually talk to someone. And then there's others that seem to be okay. You know, the Balance, the HealthNet, the Kaiser's. HealthNet, I can definitely tell you, has really improved their customer service over the last couple of years. Kaiser seems to have kind of had some real issues in 2026 and 2025 as they changed billing systems, and that caused a lot of hassle. The Blue Cross and Blue Shield are okay, but a lot of times their customer services is offshored, and that's where the mobile app can really come in handy. LA Care, you know, some people have had some issues with them, and Molina as well. So, you know, customer service is kind of a mixed bag. Some people are going to have great experience, others not so great. Online provider finder tools, because that's kind of half the battle of, you know, finding a doctor to get treatment. Now, what you'll notice here is that the online provider tools generally are pretty good for HMO plans because you have a very set network. You have to have your PCP give you a referral, but sometimes just navigating the online system can be just it's very difficult. We have to think about, you know, what mobile app you're using, the browser, and other complications with the different plan types. You need to make sure that, you know, you're an individual and family plan selection and things of that nature. So in general, some of the smaller plans have good online provider tools. And most of them are doing a pretty good job, especially when they're HMOs. Blue Cross and Blue Shield, they can be complicated, and that can be difficult for people. So it's a little bit trickier to use the online provider tool with Blue Cross and Blue Shield. HealthNet, that whole provider finder tool needs a complete overhaul. It's very complicated, and it's old. Maybe by the time this video gets put out, it will be much better. Then what about a scorecard for the overall ratings of the health plan? Kind of like a Consumer Reports. And kind of going through it, I'm not real sold on some of them. This one is from the state of California Healthcare Quality Report Cards. It doesn't even list all of the health plans open to you. And note on there, they talk about quality of medical care and patient rate overall experience. And then that immediately raises a flag in my brain, because health plans are not delivering healthcare services. Health plans authorize care and they pay claims. So Blue Shield doesn't hire doctors to deliver care to you. So sometimes quality of the medical care, yes, Blue Shield contracts with medical groups and hospitals, but they don't have a direct input into how that care is delivered to you oftentimes. So I'm not sure how good these are. And then, you know, we can see down here, like Kaiser, they have, you know, 5 stars for quality medical care. And then I wonder if people are conflating the Kaiser Medical Group from Kaiser Permanente. Kaiser Permanente is the health insurance. But a lot of people think Kaiser is all one big organization. There are 3 separate organizations for Kaiser: the insurance, Kaiser Permanente, Kaiser Hospital, and Kaiser Medical Group. And they're all independent. They work together, they collaborate together, but they are all independent. So sometimes I just wonder. Covered California does put out their own scores. They have kind of a separate survey and different metrics. But again, the health plan isn't delivering the healthcare service. They are hoping that the health plans and what they are scoring them on are things like vaccinations and the preventative services. Are you noticing your members that these options are available to them to take advantage of, the well woman visit, annual physicals, high blood pressure, things of that nature. And that's good. That's good. We all need a little kick sometimes to keep us going. But so when you see like Western Health Advantage and Blue Shield have 3 stars, I don't know. Kaiser has 5 stars. Now, you're surveying Kaiser members that are in Kaiser plans. And so most of those people will never leave. They love Kaiser and they've received excellent care. So I'm just not sure. There can be some bias in some of these. What it comes down to is a health plan that supports your providers and the hospitals you want to go to. Customer service, mobile apps are all important, obviously, as is the cost and whether it's an HMO or PPO. So there's a lot in there. So hopefully this kind of gives you an overview of how some of the health plans all fit into the California individual and family market. If you have any questions or comments, you may leave those down below and I will do my best to answer them. Otherwise, for InsureMeKevin.com, I'm Kevin Knaus.